Kybella is a non-surgical injectable that melts away the excess fat or extra layers that causes that double chin.
Dr. Spencer Berry and Danielle Bartel are here to tell us about Kybella treatments that zap away that excess stuff going on the chin. To all of you that are here this morning, thank you so much for being here. It's great to have you as always.
Well, thanks for having us. We appreciate it.
So, Doc, we hear about Kybella, but kind of break it down for us, if you will. What is it?
Well, Kybella is an injectable medication that we can use to help folks that have fullness, what they call submental fullness, double chin. Many folks refer to it as. About 1 out of 4 individuals, when they've polled and talked to folks, are concerned or bothered by extra fullness or that double chin appearance just beneath. Some have had this from early days. Others may have acquired it as time has gone by. Things like sometimes when we carry excess body weight, it'll increase this, but genetics play a big role, and aging also. So there's 3 major factors that are involved here. Now, the Kybella is a medication, deoxycholic acid, something the body does produce, but when injected locally and very precisely in this area, it helps permanently destroy the fat cells that are in that area. And then, as the body's metabolism naturally clears this out, there is healing, and as that healing takes place, it causes retraction. Okay, and so what it ends up doing is contouring the jawline and kind of cleaning up that what we call submental, or the area below the chin. And so I think you've got some pictures that they can show of some patients who've had before and afters, where it shows a marked improvement. And of course, in this day and age where it seems like photos are being taken literally all the time, many patients are very self-conscious about being involved in photographs, or different, again, social media has become a thing. And so this has been a problem for folks in terms of just emotional health. And so as we treat them, as we're able to, as this technology's come forward and allowed us to do this non-surgically, it's an in-office procedure that can take, approximately 5 to 10 minutes. And there's no downtime. Patients experience just minimal fullness, maybe a little redness and swelling for a few days. That retracts back, and then we see them back. But we individualize the treatment to them.
Nice. We're having a tech issue, Doc, so no pics, but the good news is we have a live demonstration today, which I can't wait to see. Molly, thank you for volunteering.
She's like, I'm in the zone. I'm in the zone.
She's like, so Danielle, what are you going to show us?
So you will see an actual live injection. This is the entire Kybella process. I'm going to just point out we marked Molly's specific anatomy, and then we have a little grid on here that we just inject basically right into. It's about 20 pokes, and it's very quick. It'll take probably 3 minutes.
Wow.
So.
And
all right, Doc, go to work.
Yeah, I was going to say, let's watch it happen too, but tell us, walk us through it, because some people might be nervous when they hear injections. They think of big needles.
Right, nope, it's a 30 gauge half-inch, so a very small needle, and she has iced ahead of time to naturally anesthetize the area, so she's pretty well numb. Okay, so we're gonna get started.
So, and then how did you do the color dots? Is there some significance to the different colors, or?
Well, the treatment area, and I don't know if the camera can get a good close-up of this, you can see that ahead of time, you see markings on the neck.
Perfect.
The anatomy is something that we map out ahead of time using the patient's individual anatomical structures. We're able to palpate. So this helps us place the therapeutic grid. And what you'll see in this grid, because again, there'll be different areas for different individuals, and then you can see that these dots that are in place, they're roughly 1 centimeter apart, okay? This is an extremely small needle, which allows us to very precisely place the medication so that we have utmost patient safety, but also optimal results for the patient. And that's why this is done ahead of time. When we mark structures ahead of time, the area that we're looking for is just the fatty tissue just below the skin, but in front of that, excuse me, in front of the muscle, a small muscle called the platysma. So we want to get to that area. We don't go deep. This is not going to get anywhere near the deep structures, things like arteries, veins. People worry about things that are in the neck.
So
when you're trained and you can precisely place this, as Danielle is, this allows then, once the marking is done and the grid is in place, the injector focuses on those areas, and this allows that medicine to be placed in the proper spots to give us the best therapeutic result.
Does Molly then walk up and go to work after this, or?
She may, absolutely. What we do ahead of time is we use ice. She's been icing ahead of time to help anesthetize the area for the patients. And so as we place the medication, a lot of times the patients feel very little, if any, while it's placed, because again, it's very small caliber, and then we'll allow her to use ice afterwards. And that also helps with any discomfort. Now, patients usually will note Within the first few minutes afterwards, there's a little bit of discomfort, then the neck kind of goes away.
Yeah.
And then throughout the day, just kind of some mild discomfort in that region, but nothing big. And then there's a little bit of redness, a little bit of swelling for a couple of days that retracts back. Patients do work. It's not uncommon for folks to maybe wear a scarf or something around the neck.
You also said it's permanent reduction, so am I coming back to see you again to do this?
Yes, this is permanent reduction, and so depending on an individual, the amount of tissue that needs to be removed by the deoxycholic acid and or their own particular aesthetic goals. Okay, some folks, well, one treatment is used. Other patients, because again, this does clean up the contour around the chin line, and so some patients, there'll be multiple treatments, and usually in subsequent treatments, patients will notice even less discomfort, okay? And so depending on the individual and how much, it's not uncommon that maybe a second or a third treatment may be necessary in that area, and that's usually done anywhere from 4 to 6 weeks. The initial studies were done with a treatment every month for individuals. Now we tend to wait usually 5 to 6 weeks, which gives the body a little more time in healing. We found that post-injection, that inflammation and that swelling, and then ultimately the retraction that takes place. That's the key, that healing retraction, which kind of tightens things up. That's what helps with the aging process and kind of and brings up any of that skin to kind of tighten it back. And so we've started to lengthen out the time between the treatments for that reason. And so again, depends on the individual. Many folks 1, many folks 2.
She gave us a thumbs up.
Yeah.
She's
like, all right.
Well, bam. And it's done?
It's done.
Oh my gosh.
And I am going back to work, actually.
Are
right
you
after this.
really?
After,
Now,
yep.
did you, because you had the ice on there, did it hurt? Did you feel a little bit?
Just really, you could just feel her pinching it more a little bit, but nothing.
Wow.
It's good.
You'll have to keep us posted how
Yeah.
you feel later today.
Absolutely.
Oh my gosh. And
great.
men are also coming in and seeing you guys too.
Absolutely. Both men and females, so.
Wow.
Yeah, this is something, again, it's ages 18 through 80 have had this done, or 79, 80. And so again, depending on each individual's characteristics, as I said, the desired goals, that's the main thing. Because the amount of folks who have noticed this, as I say, from a young age, and again, the genetically determined portion of that, a patient does not have to be considered overweight to have that double chin profile. And they'll many times be very self-conscious of this, and the treatment has been found to be very, very pleasing for them. And again, because it's non-surgical, something that can be done, as you saw here today, in the office fairly quickly. Patients can return to work. There's no downtime. There's tremendous advantage to that, and it's permanent. The permanent reduction is the key.
Danielle,
Yeah.
what's the website if people want more info?
Just www.dermphilosophy.com. And you can call us, 701-388-4098, or book online.
Dermphilosophy.com. To all of you, thank you so much for being here. Happy Monday. We appreciate it. Now get back to work.
Good job being brave.
All right, stay with us. When we come back, we'll wrap things up right after this.